Welcome to the board update for the April Board of Directors meeting. I'm Jonathan Higman, the Chief Executive. The meeting actually took place on the 1st of May, and as usual we started with a patient story. And the patient story this month focused on the work of the YDH Eye Clinic, and specifically on the Eye Clinic Liaison Officer, the ECLO. We were joined by Leslie Beaver, who is our ECLO here at YDH, and Anna Hanford, sister in the ophthalmology department. It was interesting to note that 16,000 people are living with sight loss in Somerset, but only 3,000 of them are currently registered with a charity to provide them with support. And the key work of the ECLO is providing that wider practical, emotional support to people living with sight conditions, their families and carers. So a really interesting session. We got to also try on a whole heap of different types of glasses that shows what it's like to live with certain sight conditions. That was followed by a departmental video. We're now putting a departmental video in each board meeting, and this month's focus was on the pharmacy department. So it took us a tour around the department, and we saw where the new robot replacement was going to be put into place. From an operational update perspective, Easter was clearly a very busy time for us. We had a record level of demand over the bank holiday weekend, with 241 ED attendances on the Monday, bank holiday Monday, and a record number of ambulances, 75 ambulances coming the following Tuesday. So some really significant spikes in activity, and we're working through the data to understand exactly what was going on, but there is no obvious and discernible patterns from within there. I think there was just pressure in the system and some pressure particularly across primary care over that weekend. I'm pleased to say that hospitals recovered well. Our escalation areas are now closed, and I think a big part of that recovery has been the about 20% reduction in our average length of stay that we've achieved over the last year, which has freed up considerable capacity to deal with that increase in demand. We spent some time talking about track care, successful pilots of electronic ordering in radiology, internal referrals in a couple of specialties where there's a pilot underway, and establishing links with Primary Link with track care. The key focus over the coming year is really going to be to get the basics right, and that includes things like single sign-on and making sure that there's appropriate access to IT equipment in clinical areas, because without that the track care benefits we're not going to be able to realise. We noted that the endoscopy service had recently undertaken a accreditation, a JAG accreditation. This is required to maintain bowel cancer screening services here at YDH, and there were a huge number of excellent areas identified by the inspectors, particularly around risk reporting processes, the leadership of the team, and the quality of care provided. One key action was around privacy and dignity, particularly around our paediatric pathways, and this has subsequently been addressed. And we're expecting a full re-inspection of that area in about 6 months' time, when we're hopeful then that will result in full accreditation being maintained. Also noting that SSD also had a successful accreditation in the month. Our overseas recruitment has continued to be very positive. A visit from the Department of Health during April. We're now recruiting for 14 trusts and have recruited 114 nurses from overseas here to YDH, and a further 175 nurses for other hospitals locally. So we're continuing with that work. The board signed off a set of revised priorities for the coming year, and we'll share that at the end of this video as a slide so that you can see what they are. But they'll be the things that, as an executive team and as a board, we'll really be focusing on. And linked to that, we also signed off and considered a new board assurance framework. And the board assurance framework is something where that considers and focuses on the principal risks facing the organisation in achieving the 4 strategic objectives that we've set ourselves under our strategy. So they're things like our financial position, the level of demand that the hospital's under, any changes in the external environment that has an impact on our ability to deliver our objectives, delivery of our quality and performance standards, and our digital ambitions, as well as recruitment and retention of staff. And those are the things that as a board we will be focusing our attention on over the coming year. We also considered our top 5 operational risks which come up through the organisation through the risk register. Jonathan Bell from our transformation team attended the board and talked around the efficiency plans. There's been some great progress since the launch event at the end of March, and the teams have been working on a whole range of improvements that they're progressing. And this will be overseen going forward via HMT. The focus of this meeting was an operational focus, and so we spent a bit of time talking about the key performance metrics. Pleased to say that although finances continue to be a challenge for us, we hit our revised control total for the end of the financial year to the end of March 2019. So that's really, really positive. But we have an underlying deficit of £22.1 million, which we need to address moving forward. Managed to maintain our strong performance against all of the quality and operational performance standards, and ended the year third best in the country for our ED 4-hour performance. And for me, this is a real testament of how YDH comes together as a whole hospital to deliver something that is really good for patients, and it reflects the way that we go about doing things and making change here and addressing such issues at YDH. We finished the formal part of the meeting considering a few statutory reports. So the Guardian of the Safe Working report, which focuses on junior doctors' hours, and our Learning from Deaths report, where it was clear that we need to have an increase in our focus on the mortality reviews, the detailed mortality reviews, which have slipped a bit during the winter pressures. At the end of the day, the full board attended a presentation by the Bath Leadership Development Programme, and it was really great to have feedback from four groups there. We commissioned a leadership programme that's been working over the last year with the University of Bath, and a team have been learning but also considering very, very real issues for us. And we had a thought-provoking, stimulating session as those teams fed back from their work. I just wanted to finish the video just by recognising once again, I think, the tremendous effort that everybody's made in delivering a really good outcome in our CQC inspection. So for those of you that haven't heard, our hospital services were rated good by the CQC across the board, which is a really, really great outcome. We've got some work to do around our money, but I think we need to celebrate the real success that we've made and the huge improvement in the way that the CQC have viewed and recognised all of the services that we provide here to our local population. So a big thank you from me, and I'll see you all again next month. Thank you.